The science is clear. Our global environment is changing. Temperatures and sea levels are rising, and we'll see more frequent and extreme weather events like heat waves, cyclones, and floods. People will be forced to leave their homes. We know that the most vulnerable people will be the most affected. We know this because we're already seeing them in our waiting rooms.
We do know that the environment has an impact on health. We are seeing now malaria in places where they were not before because the mosquito now can survive. We see introduction of mosquito-transmitted diseases such as Zika or dengue in urban settings in a larger scale. If the water changes temperature, the Vibrio cholera can survive easier. So there is a direct link between environment and environmental conditions and mainly the vector-transmitted diseases.
Planetary health is a relatively new health discipline. It focuses on the changes that humans are making to our environment and the impacts that that has on human health.
These changes to the environment destabilize the natural ecosystem, causing climate change and pollution of our air, soil, and rivers. This, in turn, affects the water we drink and the air we breathe. It means we will see disruptions to our food production systems and changing patterns of diseases, such as malaria. It means we may see new diseases we didn't know before, and also the re-emergence of other diseases. Our health depends upon the well-being of the planet, and the well-being of the planet depends on how we act. It is all linked.
We can cure people, but we also have to avoid making people sick. So we have a double responsibility as a medical organization of restoring physical health, but maintaining environmental health to avoid people getting sick tomorrow. And for doing that, we need to take our own responsibility to be the most environmental friendly medical organization we can be.
The climate crisis is a public health crisis. We must take action together.